community that mental health is equivalent to a physical pain or having as an African woman to tell you, oh, call the doctor diagnosed me or high blood pressure. But it's a shame to tell you, no, those going to increase or going to cause other physical complications, the heart disease, the diabetes, and all of the other physical diseases. So, in a short time, but if you have a family member who you suspect that is behavior, it's about time that we sit down and talk to them. Because a therapist, if they share your business with somebody and you can prove it, you sue them and you get paid for it. But that your help and that's invested in helping you
very much. Yeah, so and there's different programs I focus on is linking our community to resources. We have information on, and if you don't have health insurance, there's organization resources that we need to take advantage of. And I know to go and get assistance, but it's services that we work for and is available to us. So thank you very much, Rachel. And we're just going to move into our next questions. Vaccination hesitancy. The rate of vaccinations in our community is low comparable to other communities. And I just want to talk about what are some of the challenges, why the number continue to remain low in our community when it comes to getting vaccinated. We want to talk about some of the challenges, some of the stigmas, some of the reasons why, and then we can come up discuss some strategies and some suggestions on how we can improve the rate of vaccination. How is the vaccination safe? How is it helpful to us? And we can start, anybody can start from there.
Let me, I'll chime in on this one in the beginning. I know that at least in the African-born community, we just don't trust, right? We don't trust the they've given us things and said this is not the case. So here it is, you're coming around with the vaccine. Why do you need to give me something for me to get something, right? So for us, I consider myself a immigrant too, but anyway, right? But about us, in front of us, behind us, to classroom setting, where's the proof? It's like it usually takes years before years. And all of a sudden you mean to tell me just out of the blue, trust, they just don't trust. So then I can answer the other piece later. But the thing about it is, be honest about what it is, what's in it. Then say, I don't have all the answers. Don't cover it up with something else.
Thank you very much, Nurse Kisa. Thank you very much for that.
Well, most people were not paranoid because the system has, they use the people of color time or twice, and even when it came out, to say, hey, we can't believe you treated on a good apology or restitution, like because we did this, we wrong, and we will pay for it. It's always like they've treated the people of color like they won't treat themselves, right? So the entire medical system is not trusted wholeheartedly by people of color because of the history of the system. But to add to that, we currently live in a very polarized society. Politics has now gotten into everything. So that if somebody was a Democrat and you were a Republican, anything the Democrat says is good is definitely bad. If the person was a Republican, you Democrat, whatever that other person said is definitely wrong, right? And we then even broke up because of how polarized the society has been. So there's no medication out there that comes with 100% effectiveness. Even the Tylenol we take, it works for some people, it doesn't work for some people. There's some people that have died from Tylenol, right? There's some people, ibuprofen works for them, and other people take it and it leads to GI bleed and stuff like that. We have never had to ask for proof before taking Tylenol or taking ibuprofen. We say, hey, this is good for a headache, and you take 2 of them, right? And sometimes we don't even know if we're allergic to a medication. We say, take it, you take it, and then, you get hives or something. Before we notice, hey, you might be allergic to this thing, right? So there used to be this trust between the provider and the patient. But when society became polarized, then it's like, okay, if I believe this set of politics, then I only want to go to the doctors that believe the same thing I believe, right? So if I went to this other doctor and he says something, or this other nurse says something, but it's from the other side, we start to question everything, right? And so the vaccination became a victim of that. Now, why it worked as fast as it did, they used a completely different method for this COVID-19 vaccination than all the previous vaccinations, right? The previous vaccinations we had, basically they took a weakened format of the same bacterial virus, right? The virus, they took a weakened format, they injected you with it, your body beat the weakened one, and then it built antibodies so that when the real virus came along, some time and did that stuff, but this time around they used a totally different method, good education around the new method and all that stuff that was going, right? So it was a new thing, but because in the system, it became more difficult for us to engage with the system as robustly as the other people did.
So I will just piggyback on what he said, and he made an important point. I think trust is an important predictor of perception. Your perception depends on where you sit, whether you're at the table or you're not at the table. And so I'll just give you a history of what the U.S. has gone through. So back in the 80s, when we had the crack epidemic in the U.S. here, what happened? Black men, they were put in jails, and they were put in jails, okay? When the black people were disproportionately affected by it, the society solution was to lock them up. Okay? Fast forward to the 2000s, when we started having an opiate epidemic, okay? What happened? We started having investment into Narcan and all of that to be able to save lives, because now primarily the whites were affected by it. So when you have people who are in policies making decisions, they prioritize what they invest in. COVID-19 was very, very quickly done. The vaccination was done in 18 months because the investment that was made with COVID-19 has been unprecedented globally. No to be able to invest in. The U.S. government invests a substantial amount of money into COVID-19, and believe HIV. Since 1981, HIV has been disproportionately affecting black created to kill black people. Where if that was the case, you know, they would have done that with HIV. Okay, the reason why COVID-19 was predominantly, you know, there was an influx of resources towards because, like you said, it affected Europe, it affected the Americas, South America, and the entire global village shut down. And so there was this urgency to be able to address it, and they put massive amount of money into it, and that's why we got a vaccine in 8 months. Believe me, if there was willpower to solve TB, it would have been solved. If there's willpower to solve malaria, it would be solved. People invest in what's priority for them, and so that COVID-19 is a indication of when you have policymakers who are primarily invested in something, they make it happen. HIV is still there. 40 years later, people are still dying from HIV. More people from HIV than COVID. But who cares? Because predominantly, it affects blacks. And at that time, what was the solution? To lock young and understand.
I understand it can get
now.
Yeah. Very good point. A lot of Rachel, you want to add on?
I think that both of them have said it all. The same, because we know that it takes sometimes up to 10 years to create a vaccine. Saying nope, don't do it, you know. And with our previous history vaccine, there has been significant decrease in, like us, who speak the same language, who look the same. I mean, using our and educating people about the importance of the vaccine may help reduce the vaccine at this point, because like the whole advanced practice providers, other organizations coming up and
professionals that look like us, our patient, and it comes trust. It comes trust. And Dr. Emma also made a really good point. The vaccination is all about prioritizing. COVID-19 there's resources there, and there's time. People make time for what they feel that them, and that's a personal space. But as professionals, it's our job to educate and teach people. However, we cannot disregard their concerns. So be safe. You know, I have been vaccinated, and go out and get vaccinated, and you've already done your vaccination, you can get your booster. And my next question, professional and practitioner working in the healthcare industry, whatever it's clinics, hospitals, hear about some of the complications of COVID, some of the long-term complications. When it comes to chronic diseases, what were some of your experiences and working in the field?
Can I just say this? I know, at least in my community, I'm an educator by heart, and I do a lot of workforce global. And one thing we constantly talk about in our settings is educating with a title and have a priority for something. And they may say to you, a community. I think it's critically important for each individual to have their own mind, make their own decision on what their priority is. Because it's one thing for someone with a title to tell me to do something, and that didn't take the time to do my own homework. So for us as immigrants, for us as African-born people, it's important. Don't even listen to me and go and get you some books, go and do some questions, get to some town hall meetings, and begin to open up the dialogue so that okay? All right.
I agree with you on that. And you know, a lot of us Africans, we're religious people, so I would chime in my religious view, because the Bible says, because of the lack of knowledge, we'll perish. A lot of times we make decisions sometimes thinking that it is the best decision, but the info, because we don't have the full information. How do we go to town hall meetings? Sometimes because of the lack of resources. I think it's about time that, like we are doing right now, take the initiative, since we are the knowledgeable ones, since we are blessed with the knowledge that we have today. And great that we can meet people virtually, we can communicate with people in several other ways to be able to educate them. Because if we just depend on people coming to us to learn with the disease, they might spread it to another person within the household, and then it continues to go forward. So this that we have in other platforms, I think it's about time to go to the people, not expecting the people to a healthy community that is beneficial to us. Because if somebody maybe I live in Ramsey, somebody in Brooklyn Park is sick, I may be related to that person some kind of way through a friendship or something, and I may be affected one way or the other. So I really admire the fact that we're doing this with the intent to go to the people in the darkest and deepest corner where we can find them, instead of depending on them to come to us. I think that is a great public health initiative.
Meet the people where they are.
Yeah.
All right. Here's how I explain when it comes to treatments or medication. Anytime you take anything at all that your body is not used to, the first reaction from your body is to fight whatever this thing is that you just took, right? That's what side effects are. If you swallow the first way men figure out how to kill themselves is to drink poison. So anytime you swallow something that your body does not recognize, that what is this thing you swallow, right? So like if you're having diarrhea, nausea, vomiting, and fever and all that stuff, your body is trying to get rid of this thing you just took that your body does not recognize. And it can happen with any medication, from Tylenol to aspirin to the vaccination. When you take the vaccination, even the vaccinations we used to take before, which were like actual live viruses, was that your body fought them. So whenever you take anything that you are not used to taking, there is going to be some kind of physiological reaction. But that just means your system is working. So if you took it and you had some little headache, some fever, some diarrhea or nausea, vomiting, it means your system is working. Your body is fighting this thing you just took. Normally, I tell my patients, those effects go away in 3 to 5 days. They just go away. Your body suddenly like, okay, this thing is not poison. It's not going to kill us. It's been around 3 days, and those effects goes away. Now, it's true there are other people that have adverse reaction, which is not the usual fever and diarrhea and something. And COVID-19 is not the only medication. The vaccination is not the only medication that has happened. There are people that got liver damage just from Tylenol. I keep going to Tylenol because it's popular, right? The people that have bleeding, GI bleeding from ibuprofen, right? While other people take it. So nobody can guarantee something for the very first time, how your body is going to react to it. But the way to do it is not, well, then I will not take it, right? In a professional setting, maybe in a hospital. The directions are the 60 minutes, and nothing serious happens, then you can go home. Stigma we were talking about before. One of the things we need to get involved, right? Dr. Bowley said earlier, hey, the people on the table, the one making the decision, and if we keep sitting back and let them be treated this way. So even like I went out there looking for Africans that will participate in the test phase, right? If only Caucasians go, then of course when the report comes, the report will only speak for how this medication treats Caucasians, right? Now, if none of us participate in the research and none of us participate in the testing, but we want to benefit from it, you know, sometimes things happen to us that they didn't know about because none of us participated in the research or the testing, and then when we come to enjoy the benefit, something might happen that practically didn't happen in the testing, right? Because none of us was there. So the encouragement will be like, guys, for example, personally, when it came to me with the COVID-19 vaccine, I kind of like got the COVID myself, like intentionally. I knew somebody who had it, and I went there like, you know what? I know after reading the research and this thing, the possibility of it killing me has a little to nothing, right? And then I needed to actually get it to the age. I had my own other reasons, but I was safe enough based on the record to say I can get this thing, it won't kill me, right? But that's what knowledge does. When you get the knowledge, it takes away some of that hesitancy, and the way for us to build trust within the system is for us to get more involved. Like you were saying earlier, Madam Fangalo, is like when you go to the hospital and you see an African doctor. But how are we going to get more African if we stay away from the system? We need to get involved. We need to make decisions being made so that next time when they're ready to test people, because we are at the table.
Yes, thank you very much, Dr. Kwan. The numbers are decreasing compared to away from social distancing, and the numbers are less than what they used to. But do exist there, especially with the change of weather and the holiday circle. People are going to be gathering and coming together, congregating, and to say, give some advices or from your expertise, and let the public know what are some of your advice to people. And, there's people that most of us have COVID. I think I have COVID about 3 times. Fortunately for me, there was no major complication. There are people that were hit really, really hard. I met a gentleman that became a ventilator from COVID. Some people got COVID to live with for the rest of their lives. So people are still suffering from the impact of illness, from COVID, from the trauma. And it go back to the question again from the beginning. When it comes to our African-born immigrant committee, the population that we are focused on, and people with disability, and work. It's very challenging to convince our people, like Dr. Pan said, to come to so many resources out there. And being an advocate, I see that time, majority of our people do not use the resources. Like Rachel said too, we have to take this information to them. But how can we work hard at building a healthy community? What would be some of your advice to some of your family or our audience that have not gotten vaccinated? What would you say to that? What would you tell them?
So let me just piggyback on your first question, how do we get people involved? I think human nature, when we know there's a problem, we want to do stuff. So I think just creating awareness about the prevalence of COVID-19 and other diseases in our community, but also going back to something Rachel said, that people often want to get involved, but they don't have the resources to do it. They don't have the time. They often have to work 2 jobs, and so making sure that when you are inviting people to the table, you have, means to compensate them. If they don't have transportation, you make sure you provide them. So often with that, when we're advocating for resources for our communities, we got to make sure that we're intentional around bringing people to the table. And then the last thing is, when they're at the table, we need to be serious about being intentional around taking our recommendations and putting in our actions, because what we've heard is that often people say things and they will say these are some of the community-led solutions, and it falls on deaf ears. So we want to be careful about protecting our space. The people we serve trust us, that we're inviting them to the table to be actionable and providing them the resources to do so. We get people vaccinated, like what Dr. Kwan said, just making sure that they're knowledgeable about, as he said, I'm not a clinician, but nothing is 100%. There's always side effects. But any side effect, it's way better than being dead. And so that COVID-19 reduces your likelihood of having a severe condition or dying. And so it's reduced tremendously with vaccination. I think when we are providing people resources and helping them, some of the things, and the last thing I said, often mistrust is a huge predictor of whether you why is it that people are mistrusting government? Because there's just history. But we need to contextualize stuff. 1950s to what's happening in 2020. Okay, times are different. The events, the circumstances prioritized compared to other things that happened in the past with the species study. And so often when people are comparing apple and oranges, we as practitioners, we need to stop. Sure that COVID-19 vaccination was developed in 18 months, but these are the reasons why compared to. And so I think if we can do that, people will understand that this is an important thing. People invest a lot of money into it because they wanted to prevent deaths, and there's tons of evidence showing that COVID-19 vaccine is successful in preventing deaths.
Yes. And minimizing risks. Thank you very much. Anybody else have anything to add? So we are doing really good with time. Over the last 4 months, Community of Angel have trained and deployed over 140 community health workers, trusted messengers, to go out in the community to their friends and family to spread the words in the community. So we are, like I said earlier, we're in partnership with the Minnesota Department of Health. We're using family members, neighbors, and sometimes language barrier is also an issue, because not everybody can go on CDC website to read about information or even listen to the news and hear what's going on. So we have to be our own advocate. We have to be, out there getting information and sending it out to our loved ones. And we hope way beyond the partnership with the Minnesota Department of Health, like Rachel said earlier. There's a lot of public health and community health groups out there. I think it's time for us to take the lead. Those of us that are blessed enough to go out and gain some professional knowledge to be, a source to our community. So if anybody have a closing statement or any words of inspiration for our audience and for our community, we'll go ahead. We are limiting this to an hour and not African-born immigrant time. Although this is an African immigrant event, but it's not on the African-born immigrant time. It's on, I don't know, I don't want to say unfortunately, but yes, American time. So we're doing it. So we'll just go around in a few seconds and give us a word of encouragement, and we look forward to having you wonderful people back on here, and as we work together to build a healthy community.
All right, maybe I'll go first this time. I really wanted us to talk a little bit about what mental health is. Maybe we'll come back another
Next
time.
Yes.
Because we just throw it out there, and people have different health and mental illnesses are. And I use the word trauma a lot tonight, and sometimes a clinical definition. But a clinical definition of somebody you love has experienced, still bugging you, right? After all this time, who have had these traumatic stress incidents, or in the daytime you're having flashbacks about them, or it's like happened in the past, you can move incident. It actually shapes your perception, like this way because of that one experience you had that way. So the entire community or the entire group of people now that is still following you, right? That's what it is. And then, but there's good treatment for that thing. Medication, sometimes, so there are certain that we can help by just affording them the opportunity to talk about bothering them. And some people don't need medication. Some people need medication for just a short out of medication. But everybody needs somebody. And we are out here in our first mental health clinic here in the Twin Cities. Come on down.
No referrals.
Hey,
There you
we
go.
got our own place where we can come and loosen up. Oh, definitely. I'll put one on your
time to talk a little bit more about your service and location.
website.
Wonderful.
The name is Essential Care. And you can Google it. You can see us. You can even schedule yourself on convenience. And then let's start talking. I tell folks, you don't have to wait till you have a breakdown before you come see me. Sometimes it's good to come see me with your normal self, so that when yourself look like.
Okay,
Right?
I think I will book an appointment. Why I'm normal, or at least that I think I am. Right? Thank you very much. Rachel, do you have any closing words or inspiration for the audience?
Yes, thank you. Mental health, I would like to stay with that for now. I want to encourage everyone in our community who have not gotten vaccinated to go ahead and get vaccinated, because again, we are back to our indoor season where we're easily exposed. We might get it if we don't take the vaccine. And the risks, first is the benefit. The benefit of getting the vaccine. So just trust the process. Some of us have gotten. I got COVID. I don't have any proven fact that I have gotten COVID since I got my first COVID. So again, I can things, but I think the vaccine had a significant impact on that. So again, thank you for your time, and I just hope and pray for healthy.
Thank you so much, Rachel. Nice having you. Thanks for making the time. We appreciate you. Dr. Emma?
I'm going to be short. And I just want to say that I think sometimes we disassociate mental health from health, because if you're stressing about, providing for your family, sometimes people develop high blood pressure on that. And so it's very important around mental health and protecting your spaces. I would just say that, risk factors for COVID-19 and how has exacerbated mental health is primarily grief. If you lost loved ones during COVID-19 and you were not able to bury them or grieve with them, talk to a counselor, talk to someone, find a safe space to be able to allow you to grieve for that person. If there's, stresses because of job insecurity or whatever employment situation you're going through, like the CEO said, there are a lot of resources within Hennepin County to be able to help you with social determinants of health, whether you need food, housing, temporary housing, transportation. There are resources to be able to help you to get back on your feet. And so we are just here trying to encourage people to be able to take care of themselves and talk to someone if there's a need to.
Thank you so much. Nurse Emma? I'm sorry.
Nurse Emma?
Nurse Keisha. Thank you, Dr. Emma. Yeah. Nurse Keisha.
So my closing remarks would be around one thing I love to remind people is that your mind is the most valuable thing that you possess. And your mind literally controls your brain, right? So whatever you think about is what you become. If you don't like what you're seeing, if you don't like the information, once you go and get the treatment, the help, whatever it is that you need, coupled with getting somewhere and fortifying your mind. Because if you don't fortify your mind, when you sit in front of a TV or a clinician or anybody else that's trying to sell whatever it is that they're selling, and you don't have a made-up mind and you're not stable in your own self, you'll start to follow whatever, right? So fortify your mind. Make sure your mind is strong and healthy. Now, I have some ways in which we can do that, and my way is always the BIBLE. But everybody may not want to do that, but that's what I use to fortify my mind. Because I don't care what's coming and going. Guess what? I have the power over it. It don't have the power over me. And so when you yourself be able to stand in that space, and even if COVID do come to my door and knock and affect me, I still have my mind so that it will not control me and take me out. So I want to leave you with that. Whatever you think about is what you become. So think about what you want to become.
Thank you very much. That was a powerful closing statement. I want to tell everyone thank you so much for taking time to come here. I follow you, most of you, and I know some of you personally, and we call people on here that we know are passionate about change and passionate about giving back. Thanks to you guys very much. We'll be here once a month. Education to our community, bringing resources to our community, and we just want to say thank you very much and have a good night.